Ever felt that sharp pain in your knee while you were trying to go up a flight of stairs? It's been there for months, maybe even years, and no matter what you do, it just won't go away. And at some point, you probably ask yourself, am I gonna need surgery for this? But what if I told you there are plenty of ways to treat knee arthritis without going under the knife? Hi there, I'm Dr. Vishnu, an orthopedic surgeon. Yes, you heard that right. A surgeon making a video about how to avoid surgery. After years of practice, I've learned that sometimes the best surgery can be the one you never have to go through. So stick around and let's go over all the other options. So knee arthritis, especially osteoarthritis, is incredibly common. It affects millions of people worldwide, making simple everyday activities like standing, walking, climbing stairs incredibly painful and difficult. But the good news is that surgery isn't your only option. In fact, for most people, there are plenty of treatment options that don't involve hospitals, operating rooms, or lengthy recovery times. Let's start with something that might sound too simple to be effective: exercise. I know, when your knee hurts, the last thing you want to do is move it. But trust me, the right kind of movement is actually one of the best things you can do. Strengthening the muscles around your knee, especially the quadriceps muscles, helps to stabilize your joint and take pressure off of it. Think of it kind of like reinforcing a weak bridge. And water-based exercises like swimming and aquatic therapy are also fantastic because they reduce the impact on your joints while still helping building strength. Now let's talk about something that has a huge impact on your knees: your weight. Did you know that for every kilogram of body weight, your knees actually feel 4 kgs of pressure? That means losing just 5 kgs actually takes 20 kgs of force away from your knees. It's like dropping a heavy backpack. You instantly feel lighter and moving gets easier. So if you're carrying extra weight, even a small reduction can make a big difference in your pain levels. Alright, let's move on to medications. A lot of people rely on painkillers like NSAIDs, things like ibuprofen or aceclofenac. While they can be effective, they're not a long-term fix. If you want something with fewer side effects, topical NSAIDs like gels or creams that you apply directly to your knee can actually give relief without the risk of taking pills regularly. Acetaminophen is another safer option, but honestly it's not as effective as NSAIDs for arthritis related pain. Now what about injections? Now if you've been dealing with knee arthritis for a while, you've probably heard of cortisone shots. They're great for a quick relief, especially during acute flare-ups, but the effects usually last only a few weeks, and after that the pain can creep back. Then there's hyaluronic acid or HA injections, also known as viscosupplementation. HA is something your joints naturally produce to keep things moving smoothly, but in arthritis these levels drop. These injections can help restore lubrication, reducing friction in the joints. While some people do get longer term relief with HA as compared to cortisone, actual results do vary from person to person. PRP therapy or platelet-rich plasma is another option getting more attention lately. This uses a small sample of your own blood spun down to concentrate the healing factors, which are then injected back into your knee. PRP has shown promise in reducing pain and improving function, with some studies showing benefits lasting up to 6 months. There's also a procedure called arthrocentesis, where excess fluid is drained from the knee to reduce the discomfort and swelling, and sometimes this is followed by an injection like a corticosteroid to maximize relief. Now none of these are permanent fixes and not everyone responds in the same way, but for many people, injections can be an important tool in managing knee arthritis without jumping straight into surgery. Now braces and orthotics are also worth mentioning. A good knee brace can help to shift your body weight away from the damaged portion of your knee, making it easier to move without pain. Custom shoe inserts can do something similar by changing how your foot lands, reducing stress on your knee joint over time. And finally, there is a newer minimally invasive procedure called Genicular Artery Embolization. This reduces blood flow to certain areas of your knee, which can lower inflammation and pain. Now it isn't widely available yet, but early studies do show promising results. So if you've tried everything else and are still struggling, this might be something worth looking into. So what's the takeaway here? Surgery should always be the last resort. There are so many non-surgical options that can help manage your knee arthritis and keep you moving. And the best part is, you don't have to pick just one. The most effective treatment plans combine various approaches tailored specifically for you. Maybe it's physical therapy and weight loss, or maybe it's a mix of injections and bracing. The key is finding what works best for your body. So don't wait till things get worse, start now. The sooner you take action, the better your chances of avoiding surgery. If this video helped you, don't forget to like, subscribe and drop a comment below with any questions. And if you tried any of these treatments yourself, I'd love to hear about your experience. So see you in the next video. Till next time, take care of those knees.